Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
No. Investigations or diagnosis of Alzheimer's disease. So in the diagnosis of Alzheimer's disease, actually there is no specific test for diagnosing the Alzheimer's disease. There is no specific test for diagnosing Alzheimer's disease, and you will have to rule out the chronic alcoholism, and also we should also rule out the untreated HIV also, because both these can also produce, or they can also present with diffuse symmetrical atrophy of the cortex, which is also seen in Alzheimer's disease. So as a result, we should exclude chronic alcoholism and untreated HIV. We should do an MRI. MRI is done mainly to rule out the subdural hemorrhage or subdural hematoma. So to rule out subdural hematoma, we do MRI. We do VDRL is done mainly to rule out the syphilis or neurosyphilis in the patient. To rule out this, we do VDRL. We will do vitamin B12 levels, or we can also do serum methyl malonic acid levels. This vitamin B12 levels or methyl malonic acid levels are done mainly to rule out the vitamin B12 deficiency. To rule out these, we can do this vitamin B12 or methyl malonic acid. Thyroid function tests, actually thyroid function test, mainly the TSH, can be done to rule out hypothyroidism, because hypothyroidism can also present as dementia. Okay, all these tests are done for the diagnosis of Alzheimer's disease.
thank you and thank you for watching.